Hello, my name is Benjamin Housworth, and I'll be discussing nursing staffing shortages. During this presentation, we'll talk about nursing shortages and how they affect the overall community. We'll look at some community culture issues, how staffing shortages is an issue as a whole, the social impact that it has. We'll analyze that issue, and then we'll overall make some recommendations on how to address it. So, as we look at the community affected by staffing shortages, we can see that everyone's affected in the hospital environment, from the patients to the physicians to the nursing staff and even administration. Patients experience this issue with longer wait times, maybe some inconsistencies in their cares with having new or different nurses than they would if staffing was able to be kept the way it was the day before. Physicians experience this with the inability to admit patients in a timely manner due to not enough staff to man the beds. Nursing staff experiences nursing shortages probably the most directly because it affects their day to day work. It can affect their job satisfaction. It decreases patient outcomes, and it can increase in turnover rates and actually have effect on nurses leaving the healthcare profession altogether. Also, in a study by Cho and evidence supported by Lee, showed that actually having adequate nursing increased the patient satisfaction scores, but it also decreased medication errors, pressure ulcers, and injuries from falls. And then it also decreased the actual length of stay for the majority of patients. So the community culture affects nursing staff, patients, and providers. They all feel that staffing must be a priority. Administration sees more nursing staff as an increased cost to the hospital, and so they tend to walk that line of how do we get enough nurses to staff the unit, but not have additional nursing staff that are not full with patients. There would be a more expense upfront to hire nursing staff to account for all the training needs to make sure that the nurses are competent to do their jobs. But if you increase the number of staff available, the hospital could fill more patient rooms, and this would increase their billable services. So if you had more staff available, then you could potentially admit to a fuller hospital. Hospitals also have the tendency to staff according to patient census, and this sometimes can leave little to no room for admissions. It would also probably take away from having a free charge nurse available or a resource nurse. And this also increases the risk of floating to other departments where nursing staff may not be competent with the care and the acuity of those patients. For example, an OB nurse floating to an ICU setting or an ortho setting, or vice versa. They don't do that type of patient care daily, and so therefore they would struggle with providing patients a proper care. And the culture in hospitals tends to be patient-centered, but at times this can only be the only factor that's in play when they do need to look at the financial needs to be considered as well. So as we look at the staffing shortage as an issue, in the past, nurses have been made to take heavy patient loads and unsafe nurse-to-patient ratios. And there's been a big push in my facility to make sure that that doesn't happen. That way we have nurses who feel supported in their roles, and that way they feel they're practicing safely and providing the highest quality patient care. Decreasing the number of, decreasing the staffing ratio continues to lead to an increased patient injury, increased mistakes, decreased patient satisfaction, decreased employee satisfaction, increased wait times, and increased length of stay. I know on my unit we do satisfaction rounds, and we ask the patients, how their care was for the day, how their nurse was, is there anything that they need, is there anything that that they'd asked for that they hadn't got, and just to kind of rate our overall experience on the unit. And that allows us to kind of see how staffing plays a role into our patient satisfaction. And for the most part, when we're staffed appropriately, our patient satisfactions are a little higher than when we're struggling, or the nursing staff is struggling for the day, whether it be with staffing shortages or just an increase in their acuity of patients. Um, those things all play effect into patient satisfaction and as well as nursing satisfaction. The social impact that nursing staffing shortages plays on a facility um, can vary. Some services are available to help decrease those occurrences. And those things are like agency nursing, regional float pools, and hospital float pool nurses. The facility that I'm at has 3 sister hospitals in the uh, Kansas City area, and we have a regional float pool. Those nurses are typically nurses who are advanced in their skill set, and they have flexible schedules. And so this allows the hospital to put them on schedules that um, fills the need for the float pool nursing, but it also allows them to send them to multiple hospitals. So when census is low at one hospital, they can send those nurses where census is high at another hospital, so that nurses don't have to work short or overstaffed. And this is cost effective because they're hospital employees, not agency employees, and that allows them to make sure that their nurses are, one, satisfied, and they're not having high turnover rates, as well as filling the need where it's needed. Um, that's one thing that our leaders have taken into account. Our hospital administration works with the other hospital administrations to see where the need is at, and they flex those positions accordingly. So when we analyze the issue, Cho said that the relationship between nursing staff and the adverse events are directly related. If you have overworked nurses or understaffed units, adverse events do increase, and it was associated with an 8.9% decrease in pneumonia and pressure ulcers when the hospital was appropriately staffed. So this ultimately saves the hospital money because they don't have to pay out for those things that are preventable in the hospital facility. Another advantage of increasing nursing staffing is that it has a direct influence on patient outcomes, most markedly hospital mortality rates, and then also their satisfaction scores, which is how Medicare and Medicaid reimburses. So having happy patients ultimately means more dollars reimbursed by insurance companies and Medicare and Medicaid. And then a meta-analysis also took a look at 6 studies that showed higher nursing staffing ratios decreased the incidence of hospital mortality by 14%. This study also showed that higher staffing levels were associated with reduced medication errors, pressure ulcers, and restraint use, infections, pneumonia, and a greater number of patients receiving a percutaneous coronary intervention within 90 minutes. So what that means is better outcomes for our patients, quicker intervention times, shortened hospital stays, and better outcomes. So some of the strengths with increasing nursing staffing is that the nurses are overall more happy, not feeling overworked, not feeling just worn down. Happy in your work environment allows nurses to stay in that role. Therefore, decreasing your turnover rates and ultimately your training costs for new nurses. It increases patient satisfaction. They feel like their nurses are available more and they have time to talk with them about procedures or treatment plans or new medications. And it develops a relationship to where the nurse and the patient are actively working together to improve this patient's outcome. And then it decreases negative patient outcomes. It doesn't delay treatment. interventions occur quicker, and then the nurse can also respond to their patient in a more timely manner. That way, the patient feels that their nurse is there and able to help them when they're truly in need. Some of the weaknesses associated with increasing nursing staffing would be the cost. The hourly costs would be more, but by having more hands on deck and having all of these resources available to you, you actually can decrease the patient's length of stay, increase their satisfaction, and also decrease your turnover. So therefore, short term, your cost is increased, but long term, the financial aspect of it is much more beneficial. Another weakness is floating to other departments. Having enough staff to where you can make sure that you're never understaffed can sometimes mean having too many nurses on one unit. Therefore, you may have to float to another unit just to fill their needs. It still helps with the nursing shortage. It helps so that units don't work understaffed, but it does mean that you may be floating to another unit that you're not familiar with more often than you would like to. And then if it's truly a low census time, there can be some cancellations in staffing. And the downside to that is that nurses may be forced to use their leave to account for hours missed so that they're not short during their paycheck. But when you look at the strengths versus the weaknesses, if you have overstaffed units or slightly overstaffed units, it's going to increase response time to call lights, treatment, interventions. It's going to expedite the patient's care overall. They're going to have less negative outcomes, and those are all going to be things that affect their HCAP scores, which increases their reimbursable Medicare dollars once billing is complete. So when I'm trying to think of recommendations to address the nurse staffing issue, I kind of came up with a combination of the two things that I thought would work well. The hospital I'm currently at uses a staffing matrix to figure out acuity of patients and figure out how many nurses are needed. But using that alongside the referral system allows appropriate nurses caring for the appropriate patients, so that you don't have ICU nurses taking care of a med-surg patient and vice versa. You want nurses who are competent with the equipment that they use day in and day out and taking care of the same type of patients day in and day out, to take care of those patients, because then they have more competencies in those areas. Myself, I'm a cardiovascular ICU nurse. I get that, but I could not do OBGYN nursing. I couldn't tell you the first thing to do when I'm taking care of those patients. So I would be more of a hurdle for the staff that was up there working with these new moms, because I don't know their culture up there. And they would be deterrents to me in the ICU because they don't deal with my kind of patients every day. And so this Raffaella system looks at how acute the acuity level of a patient, and then also looks at what type of needs do they need. And the two of those together, I think, would help to assess how important it is to put a certain nurse with a certain patient when at all applicable. And then finally, these are my references used during this PowerPoint presentation. Thank you.